Okay, let's get started into our classifications of antibiotics. We're going to start with penicillins. We'll go to cephalosporins, then we'll go to our mycin drugs, tetracyclines, aminoglycosides, and we'll progress through to sulfonamides and so on. So how do you learn the drugs without having to learn every individual? So what I want you to do is picture it as this is one huge umbrella. The umbrella is actually the class. The class is penicillins. Well, what falls underneath this umbrella? And what falls underneath this umbrella is all the penicillin drugs that are there. Well, how will I know that they're penicillin drugs? Most penicillins end in cillin, C-I-L-L-I-N-S. Okay, so penicillins typically end in penicillins or end in cillins. So my umbrella is penicillin, which is my class. I know the drugs that are there because most of them, I can't say all 100%, but most of them end in cillins. So the drugs in that category would be penicillin G, penicillin V, amoxicillin, ampicillin, bicampicillin, nafcillin, piperacillin, amoxicillin, ampicillin, ticarcillin. So there's so many, but if you see the commonality here, the umbrella is penicillin, they end. Okay, so now that you've gotten your common drugs, let's look at the next thing, which would be the common uses. So under your handout that you had in your folder on Blackboard, what I want you to do is just look through all the penicillin drugs at this point, and I want you to identify any of the common uses that you see reoccurring throughout the thread of penicillin drugs. And the common occurrences that you're going to see is infection of the ear, which would be otitis media, genitourinary treatments for urinary infections, genitointestinal, respiratory infections, skin infections. These are the common uses that we see for penicillins. The next thing I want you to do is look at the common side effects. So look at all of the typical drugs that are underneath penicillins and what are the common side effects that you see threaded throughout each individual drug. The common side effects that you see would be allergic reactions, superinfections, diarrhea, reactions of the skin, which would be rash and hives. All right, so now you're finding the commonalities of this group. Now I want you to think about the nursing care. What kind of nursing care do we need to do for the broad class of penicillins? We need to get labs. The labs need to include your liver labs, which are your AST and ALT, because this is how the drugs are metabolized. We also need to look at renal because it's excreted through that. So your renal labs, which is your BUN and creatinine. Let's get some vital signs, some urinary output, make sure that the kidneys are excreting urine so that the drug doesn't build up in the system. Monitor for superinfections, which is very common with all antibiotics, and any allergic reactions. So if it's your first dose, you need to monitor for any reactions in that first dose. Okay, we also need to take in consideration if they're on a high dose penicillin, we need to be checking for any bleeding because it'll help. The high dose of penicillin can decrease platelet aggregation. Educating the patient to take the entire amount of antibiotic regardless. If they're feeling better, if their temperature's down, they need to take the full course. We need to also educate them to increase the fluids to help with the excretion of the drug. Also, buttermilk and yogurt has also been proven to help return the normal flora that has been damaged that can lead into superinfections such as thrush and yeast. There is also a 10% risk for penicillin cephalosporin allergy. So if they're allergic to cephalosporins, they're getting ready to get a penicillin, there's a 10% risk and vice versa. So you want to evaluate what is that allergic reaction to? Do they have a rash or do they have anaphylaxis? If it's a rash, a lot of times doctors will continue with the prescription as ordered, but if it's an anaphylaxis reaction to cephalosporins, they might not give the penicillin. They might give an alternative because there is a commonality that if somebody has an allergy to penicillin, they'll have it to cephalosporin or cephalosporin to penicillin. Okay, so now that we've kind of found the commonalities within the penicillin umbrella, let's look at the outlanders, the things that stand out that's different than all the rest. So look at each individual drug, and you're going to see, is there anything that stands out that I might need to know? And not everyone's going to have something that stands out, okay? You're just creating a mammoth of information. So let's just start with penicillin G. Anything that stands out? G, it's natural, okay? So penicillin G was the first natural penicillin that was actually created. I think that that's significant. Let's give credit to the very first. Amoxicillin, ampicillin, bicampicillin, they're all broad spectrum antibiotics. They're going to treat the variety, the wide array of things. And in those broad spectrums, they are also known to lead into pseudomembranous colitis as a common side effect. And that means it's like a fleshy jelly type kind of diarrhea that actually occurs because of antibiotics, and it's like a membrane is what it looks like. It's very nasty looking, but it's an inflammation or infection within the colon, and that's due to some antibiotics. So pseudomembranous colitis is a common side effect there. Nafcillin, just to kind of give you a little information on what I've experienced, we actually tried it for the treatment of MRSA, and we also see under the umbrella piperacillin tazobactam, which is Zosyn, amoxicillin clavulanate, which is Augmentin, ampicillin sulbactam, which is Unison, and ticarcillin clavulanate, which is Timentin. If you notice, these are penicillin drugs with a hyphen and a second drug. These are two drug combinations. Two drug combinations are good to fight the resistance that we talked about earlier, and they help eradicate the bacteria quicker and sooner. So these are very effective for surgical patients. We see that for otitis media, which is the augmentin that is difficult to eradicate with other antibiotics. So what we see is these are two drug combinations, and they're going to combat the bacteria a lot quicker. We see Zosyn most commonly prescribed in surgical patients to help with skin infections, as well as appendicitis and other specific disease processes. So now you've done your penicillin, you've done your commonalities, then you pulled out your outlanders. So I'm going to offer you a sheet. I hope you printed them out. I want you to do that with each individual drug as we go through. I want you to write out underneath. I'm walking you through so you'll be able to take notes as we go. And to me, that's what you need to study as opposed to each individual drug. Okay, let's move on to cephalosporins. Cephalosporins is going to be our drug class, so that's going to be our big umbrella. So what does it have in common? So look at all of your cephalosporins that I've given you on your list, and what is in the name? We usually see CEF at the beginning or CEPH at the beginning. So cephalosporins usually begin with CEF or CEPH. So what are the drugs in that category? So go ahead and list those down. Cefazolin sodium, cephalexin, cefaclor, cefoxtin sodium, cefuroxime, cefdinir, cefoperazone, ceftriaxone, and cefepime. So they all begin with ceph, okay? All right, so let's look at the next thing. What are the common uses of cephalosporins? Respiratory, UTIs, otitis media, and skin. And what are the common side effects? We typically see nausea, vomiting, diarrhea, superinfections, allergic reactions, oral yeast, and phlebitis. And with the phlebitis, we typically infuse them on in over less than or equal to 30 minutes because of the phlebitis.